My name is Mateusz Piątek, and I would like to raise a question today. Is acupuncture outdated sham, or maybe the future of our medicine? But before we jump into this topic, let's quickly answer the question, why should we even care? Statistically speaking, the probability that all of you heard some stories about negative experiences of people in our healthcare system is close to 100%. Maybe here are even some people who experience them on their own. That is why it's so important to improve our healthcare system, and that is why so many people work very hard to do it. That is also why I am working towards doing it, but I have slightly different approach than many other people. And to show you why, let me share with you my personal story. So this is me. I'm about 12 years old here. And as you can see, I am looking pretty miserable. And the main reason why I'm looking that miserable and unhealthy is the fact that at this point I was suffering from severe migraine attack and headaches of different kind. Of course, I were going to many doctors, see neurologists, went to hospital several times to all the fancy diagnostics, try all the meds that were available at that moment, and nothing seems to work. Nobody could tell me why I'm having this migraine attack, why I'm having these headaches. And nothing worked until I tried a different approach, and I tried Chinese medicine. At the first visit, I was told not only why I am having this migraine attack, but also how to prevent it. I did a couple of acupuncture sessions, and as a result of that, my migraine attacks started decreasing. That was a big shift for me, and as I found out later, for many other people. In fact, that was such a big shift that as a consequence of that, I started studying Chinese medicine in hope that one day I can help other people experience similar change in their lives. And every time when I share this story, I hear something like that, and maybe some of you thinking something like that right now. Okay, so it helped you, we get it. But isn't that just a placebo effect? Like, come on, everyone knows that acupuncture is just a sham medicine. And I understand where that comes from, but you don't have to trust me, you don't have to take my word for granted, just trust the evidence. So let's look what science really says about acupuncture. When you put the word acupuncture into the PubMed search engine, you get over 47,000 of results. As you can see on this graph here, in the last year only, there were almost 4,000 of published papers, which gives us over 10 papers every day. As you can also see on that chart here, the rate of growth in the field of acupuncture is very rapid. It grows exponentially. And in fact, this growth is twice that big as in other fields of medicine, like, for example, physiotherapy or neurology, and four times higher than, for example, radiotherapy. So we now live in a very important moment in the history of Chinese medicine and acupuncture, when the acupuncture is proved without a doubt by a modern science. Because, spoiler alert, most of these studies are in favor of acupuncture. But that's not all, because we even know how it works, or at least a part of it, because, of course, the human body is very complex, and acupuncture itself is a complex therapy. So let's look at a quick examples. We conducted some studies that showed specific receptors that are activated in acupuncture treatment. These are the glutaminergic receptors that are activated in the treatment of depression. Here we have specific pathways in the brain and in the body on the animal model that show how acupuncture regulates hypertension. And very interesting study that compares visual stimuli in the brain on MRI scans and response in the brain after needling a point on our shin, which is said in Chinese medicine to benefit the eyes. And of course, WHO is a very important organ in our medicine, so it makes perfect sense to me to incorporate their opinion in our today's debate. And in fact, WHO published a scientific review as far back as 2002 that shows recommendations for some of illnesses we have. And that's not all. There is more. There's over 60, to be exact, 68 different pathological states, different diseases, chronic pains, different kinds of pains that WHO officially recommend using acupuncture for. So now, if anyone tells you that acupuncture doesn't work, it means that he just didn't update his knowledge for the last 20-ish years. But of course, the efficiency of a method is not the only thing we should consider. So let's look at the other factors, and let's start with the safety of acupuncture. In 2006, Adrian White summarized acupuncture studies and found that for almost 5 million interventions, there were only 11 serious adverse effects. Let me say that again. Over 5 million acupuncture interventions, only 11 serious adverse effects. I am sure that more people slipped on the stairs in the hospital and broke their leg than suffered from acupuncture treatment. It is the safest medical procedure known to our medicine. Money is also the very important factor in our healthcare system, so let's look at this for a moment. And here you can see at this chart, these blue bars are the estimated cost of acupuncture for different kinds of pain. And these red lines is the border of affordability for our healthcare system. And as you can see, for every kind of pain, acupuncture is not even close. We can conclude acupuncture is one of the cheapest medical interventions, definitely affordable. But that's not all. I hope that at this point of this presentation, I convinced all of you that there is some potential in acupuncture. But we need to look at the bigger picture here, because acupuncture is a part of Chinese medicine, which is a different medical system with its own separate pathology, separate diagnostic method, separate treatment. And after studying it for over 4 years now, I am convinced that we could vastly benefit from incorporating some of the techniques and ideas from Chinese medicine system to our healthcare system. I'm sure that conducting studies, more and more studies, about core ideas from Chinese medicine can greatly improve our medicine understanding, and that is exactly why I started such research here on Jagiellonian University. And to let you know why I'm thinking that way, I want to show you one more quick example on our chronic disease. So let's look at the insomnia. In our Western medicine, we have something like ICD-11, which is International Classification of Disease. And in this classification, we have only one diagnosis for almost all sleep problems. It's called insomnia. For comparison, here is classification of insomnia, a systematic review from Chinese medicine system that shows for 9,500 patients, they found 69 different diagnoses. As you can see, much more room for personalization here. So to sum this all up, because I know my time is getting to the end, what is the utility of all I am saying today? First of all, acupuncture is effective therapy for lots of chronic diseases. It leaves much more room for personalization of treatment. It's great for prevention and is extremely cheap and extremely non-invasive method. So if you want to take one main takeaway from my today's presentation, please consider that maybe to improve our healthcare system, we not always have to try reinvent the wheel, but instead sometimes we can just look back to the methods that were proven to work for thousands of years. And with that being said, thank you all for your attention.